Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching that earwax removal video today. Really interesting case, this one. This lovely lady who's an absolute trooper through this whole thing, came through with some really blocked up ear canals. And this is probably the hardest wax I've ever tried to remove. It was really tough wax. Now, this patient had said they'd been using a little bit of, well, not a little bit, but a bit of hairspray on their hair. And what's happened with this wax is the hairspray's actually got into the ear canal and it's coated this wax, which is solidified and hardened around the outside. So imagine some earwax with lacquer around it. This is what we've got here. So you can see just how tough this is here. We've actually, we're using the Jobson horn, but it's so hard. It's actually flicking off the top of the wax there as we try and pull this out. Now, this is quite a long video, guys. It goes on for about 20 minutes because this patient did have to come back for a second visit. So I've got both visits in here. So if you do want to pause it, go grab yourself a cup of tea, a cup of coffee, a couple of biscuits, and then come back. You're more than welcome to. So you can see with this wax, it is so tough on the outside edge. We managed to break this front section of wax away here. Managed to pick that up there with the Jobson horn, but it is a really hardened outer layer to this wax. So what we're going to do now is go back in. We've got the Jobson horn back in here again. You tend to find with this tougher type wax as we have here, I'll try not to keep saying hard wax all the way through, guys, but this tougher type of ear wax you have, it doesn't tend to come out particularly well with suction. If the wax is a little bit softer around the edges or has a slightly softer surface, great for suction, but not this type of wax here. So you can see we're switching between tools quite a bit. We've managed to put a thinner piece towards the front here. So we're going to use the crocodile forceps, get a grip on that, and you can see it slowly drawing this neck section out. So we've got a good grip on the outside edge here. There we are. You can see these almost plates, as they were on Friday's video. You get these kind of plates forming sometimes in the ear canal of hard wax, and that's what's happening here as well. So we've got these kind of plates as we're pulling this and teasing this apart. It starts off as one solid plug, so one big long plug that goes pretty much most of the way down the ear canal. But as you start to tease this away, you get these thinner sections coming away, a bit like slate almost. So it chips away. It starts off with one big chunk and then chips in these longer layers. So we're switching back now to the Jobson horn. And you can see we're just repositioning this now and peeling away from the canal wall, back in then with the crocodile forceps to hold on to this and just very slowly draw this down the canal. It's crumbling a little bit under the force of the forcep here. So back in now with the, we've got this is the Rosen inserter here, I think we've got actually going on this one. No, it's Jobson horn, sorry. So we're just going to pull the Jobson horn now. You can see I'm taking it from the side, trying to draw this, trying to hold onto this hard section of wax and pull this forwards. This lady was an absolute diamond. She was so good. An audiologist is only as good as the patient that's sitting for them, and you can see how tough this was to remove. But she sat through it like an absolute trooper. She did so well. So we're just drawing this down. There we go. And pulling this forwards here. There we are. You can see again the Jobson horn just flicking off the top of this plug. So back in now. Crocodile forceps, it's just too crumbly. It's this in-between consistency we have here where it's really hard around the outside, but it's so hard in places that it's brittle. Now, I've only ever seen this sort of once or twice before where hair lacquer's got it. You see it a lot with hearing aids. A lot of people sort of, it bungs up the hearing aid and blocks all the microphone ports and things. But you can get it with earwax issues as well, because especially if you're spraying a lot of it there, it's going to end up in the ear canal just coating that surface, and it really toughens up that outside edge there. So we've just got a little bit more coming forwards now. We managed to get a good grip behind it, rolling this wax down this hard plug. There we are. You can really see it starting to come forwards now. I've slowed this down a little bit in places, guys, so you can get a good look at this coming out. But it is just tough as old boots, that is. If we take a look behind it, there you are. You can see some redness there. There's a little lift of dry skin there on the one side as well. Now, we are getting this patient back for a second visit, so you will see us tidy the ear canal up a bit later on. Now, this ear, oh my goodness me, the first ear was tough. But this one was super solid. It had just completely solidified, and the full length of the ear canal as well. Now, if you're lucky, it'll pull through as one giant plug and out it'll pop. We had one of those recently. But what's happened here, there's just this, it's like a really tough clay. I thought of a really good analogy for this earlier. My son plays with slime sometimes, and you get this slime that has these little polystyrene beads in, and my goodness, it's super sticky but super tough at the same time, and that's the kind of consistency of this wax here. So you can see we're creeping over the top. But as I'm trying to pull the Jobson horn through it, that's all the Jobson horn is doing, is just running down the surface and just sort of taking a little bit off the surface there. It just won't get into that plug. It is such a tough old plug. Now, the other thing that's going on with this poor lady is that she has a very, very narrow entrance to her ear canal, which does make things a little bit difficult from our perspective, because obviously you're going to have to try and get the tools in there, but you haven't got a tremendous amount of maneuverability. So what I'm trying to do here is use the Jobson horn just to chip away at this plug until we can open up some kind of gap and maybe try and get behind it. But you can see it's very, very tough. Now, the lady had been using a bit of olive oil before they come through, but because the entrance to the canal is very narrow, when you're putting drops of olive oil in, somebody asked this in the comment section as well quite recently, how do you administer the olive oil? The best way to do it is if you hold the top of the ear and pull up and back, it opens the ear canal up, and then you can get the dropper just inside, or you can get olive oil with a spray on it as well, and that helps to get the drops in. Now, because this lady's ear canal was very, very small, she obviously was administering the drops, but a lot of it was just sitting on the surface. Plus you had this lacquer over the top of it. So it wasn't really impregnating into the wax, which is what we want it to do to soften it up. You can see here, just by using the Jobson horn, it's almost working like an ice cream scoop or a melon bowler. It's just taking this kind of, this central hole out of the wax, this central kind of, just concaving it in really, which is not proving particularly helpful. You can see the narrowness of the canal there. That's the standard size Zollner tube there, and we're having to hold the ear canal open to be able to get the suction tube in. Now, what can happen sometimes if you pop the suction tube on a very narrow canal is the side walls start to collapse down in front of the suction, which forms a perfect seal around that Zollner tube. And you imagine that you're pulling a vacuum in the ear canal, and you can cause some barotrauma sometimes to the actual eardrum. So trauma where the eardrum's pushed or pulled too far in one direction. That's what we call barotrauma. So you can see now we're just pulling this next section. We've got the crocodile forceps. So we're switching tools. I forget which one we're doing. We had the crocodile forceps in there, but the same thing again, quite brittle. You can see a layer of skin now just underneath this kind of whiter, lighter material there. A bit of dry skin surrounding this plug as well. So we've got dry skin, lacquer, we've got hardened up wax in here. We've got the whole lot in here going on at the moment. So we're just maneuvering this outer section, just trying to move it around a little bit, loosening it up a bit with the suction before we go back in now with the Jobson horn. And we're just going to go over the top and try and pull this forwards. We do see the Rosen inserter very briefly later on as well in this one, just so you can, and I do show you that at the end as well, so you get a good idea of the size of that as well. So we've managed to get that front section away. We can see where the Jobson horn's been scooping down the front of this wax here. So let's use this little bit of loose wax and skin at the entrance. Let's try and peel this off the canal wall a little bit, because it's really, really stuck there. It's formed this I can't say the word hard. Here's this tough, sticky kind of plug going on in there. Can you see how the wax is just, when you get hold of it, it doesn't unpeel. It just kind of, it moves and sort of squishes and stretches against the Zollner tube there. So back in now, there we are, back in now with the Jobson horn. Now we've kind of pulled that away from the canal. Let's draw this down. Don't forget, ear canals are really sensitive little things. And if you go digging and pressing really hard against the canal, it can be really uncomfortable. So you can see from the outer section of the ear canal here, we've introduced a little bit of olive oil. We want to try and take some of that stickiness out of the wax. We've broken away that front end of the wax now. So any oil we put in is going to manage to sort of impregnate into the actual wax plug itself. And because it's so sticky and really stuck to the canal walls, we're having to kind of maneuver this around a little bit as well and work the oil down the side of this wax just to try and get this away. The downside of using olive oil, and this is, I think, is one of the downsides of the endoscope. The endoscope is a fantastic tool. It's really, really helpful for us. But when you've got a particularly narrow canal here, obviously you're trying to accommodate the endoscope and the tools in there. When you use olive oil as well, the olive oil tends to sit on the surface and of the canal around the cilia, and it can just keep blurring the endoscope when you go in. Now, somebody in the comment section came up with a really good idea, which is use a cotton bud around the outside edge, or use a little cotton swab. Which obviously I read that comment after this patient had come through. So we've got some now, so we're going to try that and see how well that works. But you can see we're trying to tease this whole thing apart, just really slowly working this out of the canal. But it is stuck. It is really not wanting to move. It is formed so perfectly to the canal wall that it does cause quite a few problems for this patient. Now, I get this a lot in the comments section. They say, how can the patient let their ears get this bad? Here in the UK, during obviously COVID and the pandemic, you can't get this done at the GPs, certainly not here in Wales. I don't think you can do it in England as well. And people are really struggling. They've been like this for a little while. Obviously, the hospital hasn't been doing it. And a lot of people don't realize that you can get this done through clinics like ourselves. So this poor patient's been stuck like this since the first lockdown, which was back in March last year. So you can imagine how frustrating that is for patients as well. So this is obviously, it was blocking up at that time. It's hardened up since then. We've got more hair lacquer gone over the top of this as well. So really plug this up. You can see what I mean about the view there. You can just see it almost like sort of coming in and out. That's a little bit of olive oil just getting over the camera lens. There we are. I've just realised I talked non-stop for the last 11 minutes and 24 seconds. I'm sorry, guys. So it's starting to come away a little bit more now at the bottom. Got a little bit of dry skin in there as well. There we are, holding the ear canal open here with the side of the endoscope so we can accommodate the standard size ulnar tube. The fine end, it just won't pull this out. Sometimes you can use the fine end to break down bigger chunks of wax, but the fine end wouldn't hold on to this sort of skin debris you've got here. It just wouldn't have enough suction force behind it. So we're really working this around the outside edge. Oh, quick update on Taylor as well, guys. He's doing fantastically well. We're really pleased. He's doing really well. So Taylor's got a bit more training now this week, and he's got a bit more training with the endoscope towards the end of the week, and then he'll be out on the clinic on his own. So bear with us again this week, guys, if you don't mind. I'm trying to squeeze these sort of voiceovers in when and sort of as and when I can. Keep the comment section, keep the comments coming as well, guys. We get about 200 comments a day. So because obviously we've got a lot of back catalogue of videos, I will try and answer as many questions as I possibly can. If there's a recurring theme that comes up, I'll drop it into this video. And while we're on the case, thank you so much to all our viewers and subscribers. We had 350,000 subscribers the other day. I never thank you guys enough, to be perfectly honest. You're such a loyal group of viewers, and you know the same names pop up every single video, so thank you so much for the regular viewers as well. If you're not a regular viewer, please consider subscribing. They're a lovely community. Drop and say hello in the comment section below. They're a lovely bunch of guys and gals, and they'll all come across and say hi to you. So we've managed to get this last kind of plug. We're starting to break this down a little bit. Now don't forget, I did say this patient has 2 visits. Basically because this last section here is so tough and so stuck deep in the canal. It's right up against the eardrum. It's not a pleasant place to have it taken away from. So the patient did so well to get this far. We do clear a little bit more here, but they do have to come back about a week later, I think it was, maybe a week and a bit, where they just oiled this ear canal religiously for that sort of week and a half. And that really helped to soften this up. So we're still on the first visit here at the moment. You can see the plug now, when we hold on to it, is just getting a little bit of movement. It's starting to wiggle a little bit, but it's deep and it's narrow, and it's really hard to get enough of a grip on this back section, this last deeper section of wax here, to really get this moving. So we've opted now to go in with the fine end. There's a little bit more olive oil gone in here. So what I'm going to use the fine end to do, we know it's not going to hold on to this plug enough. So I'm just going to use the fine end to just see if we can scrape down the surface and just draw and roll this forwards. You can see I'm trying to use this motion where I go onto the top of the wax, and then as I pull, I draw back. So I'm trying to attempt to turn the wax. So I've broken a little bit off, and anything we break off this is going to make this plug smaller, gives us a better chance of getting this out. But what you'll start to notice now, can you see around the outside edge of the ear canal? The ear canal's gone this very pink, almost red in color. So this is really getting quite irritated in here now. All the blood vessels are starting to come to the surface. So we're not going to do too much more. This is the rosin inserter. I just want to see if I can insert this into the wax, whether it pulls the whole plug out. But as you can see there, what happened, it just cuts straight through. So cut to the patient's second visit. So this is the first ear canal we cleared last time. You can remember I said we'd go back and tidy up this a little bit. There was that little bit of dry skin here. So this is what we're going to go in now. Patient's been using a bit of olive oil here as well. Let's get rid of all this dry skin debris just to completely tidy up this, this one particular canal. There we go. That's come away, and we take a look behind. You can see the eardrum there, looking nice and healthy. There is... hang on a sec, we are going back in. There we go. You can see there's a little bit there just left at the base of the canal. Let's just lift this up. It's a little bit of dry skin and dry wax there. Teasing it just at the anterior recess here, that little valley just in front of the eardrum. There we go, that's gone, lovely. So this is the patient's other ear. So this was the second ear we did on the first visit. So you can see now they've been using olive oil for about a week and a half. Look how much softer that looks at the entrance here. The wax has actually started to migrate down. Now that will happen with jaw movement. So it's got to the outer part of the ear canal there, but you can still see a little bit of dry skin, a lot of olive oil in here, but it really has softened that surface. You can see the difference a week makes. So we could have carried on the last visit, but you could see it was getting irritated and just starting to look a little bit red and sore in there. So what I prefer to do, if a patient gets to that point, let's get them back in a week. Let's use some olive oil. We've taken the worst of it out. That'll really help to soften this last section. It's a far more pleasant experience then for the patient to have this removed. At the end of the day, your patient is the one that's got to sit through this, not you. So if you think that you can do it much more gently and have a much more pleasant experience for the patient by getting them back, always get them back is my philosophy on this one. So you can see here that plug has started to migrate down the canal. So we've got we just tried the standard size ulnar tube on there, but it didn't really budge. So now we've got the rosin inserter in here again. I'm just trying to move. You can see how narrow this canal is. I've got to try and position everything to maintain the view here. But we're going to just pop it into the top. Let's see if we push it into the wax. There we go, and pull forwards, being conscious not to push it so far that it actually digs into the canal. That's the last thing we want to do. So I'm just seeing if I can break this down, loosen it up a little bit, because obviously it was still quite a smooth surface on there. So we've managed to loosen the one side. Let's go back in now with the standard size ulnar tube. And you can see I've got a bit of dry skin there. I'm trying to lift that dry skin, but it's not really budging. So let's aim a little bit higher on that plug, just above the dry skin. There we go. We're getting a little bit of movement where we loosened all this up with the rosin inserter just a second ago. There we are, that dry skin now is all starting to lift. You can see it all coming away from the canal there. We got a bit of light at the end of the tunnel here, guys. I think it's starting to move. We've got a bit of wiggling going on. Not turbo wiggling, I promise I'm not going to laugh this time, but you can see we've got it really kind of wiggling around the outside edge. We've managed to maneuver it and just slowly draw this forwards. There we are, we managed to take that whole dry section away there. Let's push that ear canal back open again. Let's go back in now for the next section. There we are, very, very slowly working this down. Remember, it was really crumbly at the last visit, so we're trying not to break too much of this off. I want to draw this section. I want to keep drawing this back section forwards down the canal if we can. There we are, we can see the plug there. Now, I know that somebody in the comment section is probably going to say, well, when are you going with a Jobson horn? And that's a really valid question. The reason we don't go in with I haven't got in with a Jobson horn yet, is because sometimes when you get plugs like this, it's always really difficult to get above them with a Jobson horn. And if you've worked really hard to get a plug to the outer part of the ear canal, the last thing you want to do, imagine this is your wax plug, this is the Jobson horn, is clip the top and roll that back because it's going to make it a lot harder to get that away. but we're very, very slowly working. And see how it's now getting to the outer part of the ear canal. Now, when you get it this far, you could now go in with a Jobson horn if you want to and just try and sneak over the top of this because you've drawn it down that little bit further. But if I can really kind of wedge it, we know the ear canal walls are quite flexible, certainly at the entrance here, wedge it between those two, there's less chance then if I do manage to go over the top with the Jobson horn of pushing this further in. As it is, it's moving with the suction. So I wouldn't change tools at the moment until it gets completely at least stuck, and then I would probably go in with that Jobson horn. So we're still going to work this. If we can pull it through this gap, a little bit more of a wiggle. It's on its way, guys. It's starting, you can see it's breaking, it's just lifting that base section up here. We've got to get it through that little gap. It's almost there. Ah, it's so close. Right, okay, Jobson horn's going to go in. We've wedged it. Let's see if we can get behind it with the Jobson horn. We're going right over the top of here. Is this a Jobson horn or is this a Rosen inserter? Do you know what? Oh, this is a Rosen inserter. I'm so sorry, this is the Rosen inserter. I was just seeing if I could get behind it. There was a tiny gap at the top. So obviously I didn't want to risk the Jobson horn there, so we went back in with the Rosen inserter. Sorry, my mistake, guys. And then as we pull this forwards now, we've managed to loosen and break that front section, and this is starting to shift. It's got really wedged in the outer part of the ear canal. We just shifted position. Let's get a good grip on the top here. Draw this forwards. Let's get this out of that ear canal. There we go, and out that comes. Let's have a look behind it. There's one little piece left in, so we're just going to hold that canal open. Suction tube goes in, and up that pops. There we go. Lovely, and out that comes. Oh my goodness, this patient was so relieved to get this out. They've been struggling for so long, bless them. Ear canal looks good. You can see the blood vessels that come to the surface there over the top of the hammer bone. But on the whole, that ear canal looks absolutely fantastic. There's a little tiny bit of dry skin there. I completely forgot to recall what came out the first visit. But you can see here, this was from the second visit, so we had 3 centimeters, or just over an inch, inch and 1/8, I would say that is. You can also see the Rosen inserter on there, because I keep forgetting to show you the size of this. But that's the Rosen inserter there. So you can see a very, very fine end on there. Very thin, great for breaking wax down. If you had a really, really solid plug-in, you could get over the top and pull that through. Work fantastically. And breathe. And there we are, guys. Well, thank you so much for watching our video today. As always, please take care of yourselves, take care of one another, and take care of your ears as well, please. And I'll see you again on Wednesday. But as always, guys, see you soon. Bye.